Hi there and welcome to Module 3. This time we're going to talk about the rest of what's going on with the patient other than just the wound. So far you have been able to determine what has caused a wound, and now we want to look at what's going on with the rest of the patient. You need to look at the whole person to find out what is contributing to impaired wound healing and do whatever you can to mitigate those factors. If the patient has nutritional deficiencies, address that. If there's dehydration, address that. I've listed some things that can have a harmful effect on wound healing, so you can either provide interventions to counteract them, such as keeping blood sugars controlled with diabetics, or measures to eliminate infection, if that is a problem. At least you would want to be aware that a wound might take a long time to heal, as with immune suppression or renal disease. In that case, you might want to take extra steps to prevent infection, like the use of antimicrobial dressings, and you might want to change your goals to prevention of further breakdown and preventing infection if you think the wound won't heal. Regarding smoking, I can't stress enough how important it is for wound care patients to quit smoking. Every time they have a cigarette, they cause vasoconstriction, which results in significant decreases in tissue oxygen tension for an hour. So imagine if your patient has one cigarette an hour, he's constantly restricting oxygen to his wound. According to Bryant and Nix, in the latest edition of Acute and Chronic Wounds, reduction in tissue oxygen lead to lower amounts of collagen production and reduced wound strength. If your patient will not quit smoking, it needs to be clearly and frequently documented that they were offered smoking cessation help and that they were told the effects of smoking on wound healing. It shouldn't surprise anyone if the wound of a smoker won't heal or if it gets infected.